Teaching pharmacogenomics, or how genetics might impact how patients respond to drugs, is actually really challenging in a curriculum, especially when we have limited time. We created the Test to Learn program to give students an opportunity to actively participate and get the most out of the limited time we have with them. We provided the students an opportunity to undergo personal genetic testing as a pedagogical tool to actually allow them to engage with the content more and therefore to learn at a much higher level. This really took it to a new level because they were able to go through exactly what their patients go through, get the data back, and get through that raw data, take it all the way from a bunch of letters in a genetic code all the way to a recommendation for a patient. And we had to create a process that allowed them to go through that data in class and remain essentially anonymous. So to do that, we allowed them to download their own data, and we actually created brand new tools that allowed them to bring the data in on a USB stick, put it in a computer, and essentially pull up that data and work with it in a way that we wouldn't know whether they were working with their own data or working with data that was provided to them that was from a public database.
There's an inherent problem with working with genetic data in a classroom environment, in that using direct-to-consumer tests like 23andMe, which we used, allows students to have a massive amount of data that has the potential for uncovering medical risks or predispositions that they may not have known about beforehand. In lieu of that, we needed to develop an innovative tool that allowed students to parse their genetic data and get information that was pertinent to the material that we were trying to teach without giving them the keys to unlocking a lot of the scarier things that are hidden within their genetic data.
And we asked them to look at the genetic code, see what it might mean by going out to references that we talked about in class, so to try to interpret it. And then importantly, to take this information and bring it into with all the other variables that we know impact drug therapy to make very good decisions.
I found it to be highly impactful because I teach cardiology-based cases where the students incorporate clinical information into making medical decisions and recommendations, and truly having the genetic information, particularly the personal genotype, really made, I thought, a huge difference with respect to their learning, because they could see how do you effectively integrate a patient's genetic information into clinical decision making.
One of the most important outcomes we found in the course is students feel a lot more confident about their ability to use genetic testing results actually in making clinical decisions. So we plan to take this data moving forward to offer it to future classes in pharmacy, to extend it across to other health sciences schools at the University of Pittsburgh, and then out to practitioners in the community. Because we really feel that having this skill will help pharmacists take charge of medication therapy in the future.